Strength training, so that's just like lifting little weights. It's moving your body. It's increasing your basal metabolic rate, gets your heart going a little bit. Better than nothing. We all have sedentary lifestyles. The amount of time we spend in front of screens, TVs, computers, laptops, and tablets, immense, immense. Our kids are doing the same thing. They're playing video games. They're not playing outside anymore. We don't have parks as much. All of these things affect us. So get moving. Strength, flexibility is better than nothing. If you have pain because you have shoulder dislocations in the past, you have knee pains, work with the physical therapist and start slow. Start by maybe just doing stretching exercises, maybe just by moving, small little things. Second tier over here is walking. You don't have to run marathons. Walking. Walking is better than nothing. If your knee really hurts, get into a pool. You don't have to swim. Walk in a pool. That's better than nothing. Walking in a pool actually gets your heart rate up and it's less impact for your knees and your back. Rowing machines are better if you can't get in a pool, if you don't have access to a pool. You can get to a local gym. Rowing machines are very good. That's mostly hand, upper body work, not as much running, so it's low impact for your knees as well. Stationary bikes, very good. And again, you don't have to go to a gym and spend an hour there. No, go there for 15 minutes in the morning, 15 minutes in the evening, that works. A total of 30 minutes during the day. You just have to get sweaty. Remember, get sweaty. So this is one of the most recent studies. So it was published in 2022. This was presented at a recent Alzheimer's Association conference. And basically, what they found is the following. These are the highlights of the study. What they looked at is they looked at synapses. So those are the connection between cells in your brain. And what they looked at is how does the synaptic integrity look if somebody exercises? How does exercise affect that? Because we know that all types of dementia eventually breaks down your synaptic integrity. And they found that firstly, greater late life activities. So remember, these are not young people. They have looked at people later in their life, so 60 and up. And they found that people who were more active had more synapses intact in their brain. And the relationship was strongest the earlier they started. So start early, as early as you can, which is today if you're sedentary, right? And the relationship was independent of pathology. What that means is no matter what type of dementia you have, it worked. So it doesn't matter what type of dementia you have. And finally, this is one of the most modifiable tools we have to help our brain. So get active. Okay, next is cognitive training. I get this question every day in my clinic. What should I do to keep my brain active? And basically anything that's not watching TV. So this was published out of a cohort of at Mayo Clinic Study of Aging, one of the largest cohorts in Olmsted County. And what they found was this. So these were normal people over the age of 50 that were followed over many, many years. And they found whether they ended up developing mild cognitive impairment or not if they did any of these activities. So there is playing games, craft, using the computer, social activities. So no matter what you do, over here, if this is below 1, that means this hazard ratio over here, 1 being no effect, and below 1 showing that all of these activities prevented onset of mild cognitive impairment or any type of cognitive impairment. So there was not one activity that was shown to benefit over others, and depending on what kind of activity you do, you may have anywhere between 7% to 23% risk reduction in a study that was published yesterday. That's a lot of risk reduction. So, if you spend a lot of time watching TV, let go of your favorite shows. Start with anything. Craft, creative things are very good for your brain because they activate the right side of the brain for most of us, which is very difficult to activate. Painting, music. I'm going to put in a plug for one of our musical therapists who does the Shine Your Light program. And you can get more information at the Bechery counter over there. But really, that's a great way to get your brain moving. So creative activities are great. Puzzles are great. Puzzles actually are a great way to get together as a family and have fun. And so last week I saw someone in clinic who said to me, but puzzles are like things kids do. Like, I really don't enjoy puzzles. And I said to them, well, I'd like you to get a 1,000-piece puzzle of the Grand Canyon and put it together. And then you will see that it is not really something kids do. It's very difficult. I have one. Okay. Computer use. So this is really challenging, right? Because some of our generations didn't grow up with computers. So it's hard to pick it up. And a lot of times I hear, well, I was never really a computer person. And I don't mean for you to go in and become an IT software technologist. That's not what I'm suggesting. I'm suggesting doing simple things, like maybe sending an email, maybe playing a game. So simple things, and I'm not saying you need to learn that over 2 days. So one of the challenges we have is that if we ask somebody to show us how to do something on a computer, they show us one time and expect us to remember it. It doesn't work like that. So use the strategy that Janice told you earlier and made you participate in writing steps down to do something. We know that we feel that if our brain is functioning normally, we should remember it all in our head. No, we don't. There's nothing wrong with writing things down. So write it down. If somebody shows you how to do something, write it down. And practice and practice and practice until you can, and then you will be able to use the computer. Now, I'm not saying everybody needs to use the computer all the time, but this may be something that will help you. And then playing games. Lots of board games, fun times to spend with family, creates memories. And depending on who is participating, you can adjust the level of the games, simplify the rules, all of those things. Diet. Everybody asks me, what should I do to my diet? And this goes back to us talking about fast food earlier. Stay away from fast food, packaged food, food with lots of sugar. It's the MIND diet, so which is the Mediterranean plus the DASH diet for high blood pressure. Together, they work really, really well. So then everybody tells me, well, what is the Mediterranean diet? Well, this is the Mediterranean diet. You increase your vegetables. Why? Because you get folates, vitamin E, etc. in your brain. So I always tell people, because people take a lot of supplements when they go to the grocery store, they buy the vitamin supplements and this and that. This is a better way to get your vitamins. If you're going to spend money on your vegetables. Well, one of the problems with that is we make it difficult for people to eat healthy. Fast food is cheaper than going to the grocery store and getting fresh food. So tell your leaders, political leaders, why this is important for you. Blueberries, berries have been found to be the best in terms of antioxidants and food that provides the best brain health. Decrease packaged food consumption as much as you can. And sometimes when they say we have no preservatives, make sure that they're actually saying that, right? If you do buy something packaged, preferentially cook with olive oil. And fish at least once a week, reduce the amount of red meat. I have many people come and say, I'm a meat and potatoes kind of guy. And I said, not anymore. You're gonna have fish. If you're gonna have meat, try to have chicken and turkey. Imagine it's Thanksgiving every day. Okay, hearing loss. We talked about how big of a modifiable risk factor this is, and we talked about some ways of doing this. So dementia is more common in people with hearing loss. And the reason for that is hearing is step one of creating your memory. If you don't hear me, you will not remember what I said. If you're in a crowded room, or even amongst your friends, with multiple people having multiple conversations, if you have hearing loss, it becomes difficult to follow conversations. Then your brain stops paying attention. Once your brain stops paying attention, you cannot remember any of those conversations. Then you tune out and socially withdraw because you can't be part of their conversations anyway. So this is a vicious cycle. The other thing is that we have found over and over again, when we treat people's hearing loss, their cognitive scores get better. So most people have had a test in their doctor's office. They give you 3 words to remember, right? Tell you 3 words. 5 minutes later, what are those 3 words I asked you to remember? Well, if you didn't hear the 3 words, guess what? You're going to get them wrong. So if I said face and you heard faint, right? You're going to tell me faint. So nothing's wrong with your memory, but I'm going to mark it incorrect because it was not face. Masks don't help, right? It's harder to hear people with masks on. So stop people. Tell them I can't hear you. We have amplifiers in our clinic to help people hear things. And when you go to the doctor and they give you a hearing aid, a lot of people come to our clinic and say, well, the hearing aids don't work. Of course they don't work because they're probably not fine-tuned to you. So, you know, we had Dr. Mark Sims, who is an ENT physician, speak to us. And he said to me this, he said, well, you know, if your patient goes to their doctor and has high blood pressure, the doctor gives them medication for the blood pressure. Well, they'll check if the medication is working or not, right? They would repeat the blood pressure the next time they visit. Well, we don't do that with hearing loss. We give them the hearing aid, send them back home, expect it to work, don't check whether it actually works. So, be your own health advocate. Go back to your hearing doctor. Say it doesn't work. Optimize it as much as possible. And then give your brain time to learn it. So our brain circuitry from our hearing, right? So what we lose is our nerve ability to really hear the volume of the voice or the pitch or the frequency, right? We call that sensory neural hearing loss. And the nerve conveys information into what we call our primary auditory cortex. So that's the area of the brain that's processing that information. And we have found in studies that when people have untreated hearing loss, that area of the brain doesn't light up anymore. So then it decreases its sensory processing. And those areas of the brain are right next to areas of the brain that generate language on the left side, and then also right next to the memory circuitry of the brain, and they feed into the memory circuitry of the brain. So obviously, they have a way of modulating this. This is a very underfunded, understudied area. How expensive are hearing aids? A lot, right? And so if somebody's having memory loss, then they get their hearing aids, and they're, losing the hearing aids all the time, and misplacing them, and then the family just gives up, right? That happens a lot. So it's very important for when you get hearing aids, if you have memory loss, for your family members to be as involved as they are in managing your medications, to remember and find your hearing aids. As much as your wallet, it's just as important. Okay, go listen to Dementia Untangled, Dr. Almond's episode for more. Okay, finally, vascular risk factors. So this is a graph that tells you, as we age over here, what are the different types of pathology we see in our brains. So this is autopsy data after people donated their brain to us. So most people, this orange part right here, have Alzheimer's disease. That is statistically the most common type of brain disease that people have at death. The second most common, right here, is cerebrovascular disease. Most people over the age of 80 will have at least 2 or 3 different types of problems in their brain. On top of Alzheimer's disease, right? And then there is this other entity called hippocampal sclerosis, and then there are other Lewy body disease, that. But really the 2 main chunks are taken up by cerebrovascular disease and Alzheimer's disease. Now you hear a lot about Alzheimer's disease, and we're talking about cerebrovascular disease. This is when you go to your doctor, sometimes you get a brain scan, they tell you you have white matter disease, it's okay, it's normal, it's aging related. No, it's not. Okay? It's just as much aging related as high blood pressure is. Is high blood pressure normal? No, it's not. Is heart attacks normal? No, it's not. But do older people get more heart attacks and more high blood pressure? Yes. So that's the same idea. It's not normal for your brain to have vascular disease or small vessel disease or white matter disease, all these terms you'll hear on your brain scans. It is more common because of our risk factors: high blood pressure, diabetes, cholesterol, obesity, smoking, alcohol. All of these things, as you know, we have more of as we get older. So that's, oh, and I forgot in here, sleep apnea, another risk factor. So all of these things increase our risk of cerebrovascular disease. And when we have more cerebrovascular disease, that increases our risk of decline, accelerates decline if we have Alzheimer's disease, all of those. That's why it's so important to prevent all of these. In addition to the fact that there were modifiable risk factors we talked about. So if you have Alzheimer's disease, and you have this green cerebrovascular disease on top of that, well, 2 things are always worse than 1, right? And the other thing that I tell my patients is this: you can have different variability degrees of Alzheimer's disease. You can have degrees of vascular disease, mild, moderate, severe. How much it will affect you will depend on your brain. So what do I mean by that? I tell people white matter disease is like construction zones in the information highways of your brain. So the more construction zones you have in your highways, the worse. But if a little bit of construction zone is going to affect your brain or not will depend on how big your city is and what the traffic is. So it works the exact same way. Construction zones detour, and so your brain may detour information. It may slow down processing of information, and it may sometimes lose information, all of which make your memory loss worse. Sleep and dementia. Very, very important. I cannot stress this enough. You must sleep for memory consolidation, and you must get good quality sleep for memory consolidation. It's one of the very important steps of memory. And so, remember sleep hygiene you did with your children when you put them to bed? You got them to have dinner, get a shower, put them in bed, like read them a book or a story, and then they went to sleep. yeah, we lose all of that when we get older. And so what we do before bed now is we watch TV, our favorite late night show. Then we go into our bed often and we are on our phones, scrolling, or on our tablets. And then we try to go to bed. And then we don't get sleep. And so you have to work harder to sleep when you're older. Stop scrolling on screens before you go to bed, about an hour before bedtime. Get your brain tired. Reading a book, hearing something boring, gets your brain tired. That's why you fall asleep in a lecture. Yeah, it's true. And sleep problems, we know, accelerate Alzheimer's disease over and over again. Obstructive sleep apnea has been shown to increase deposition of amyloid in the brain. And some sleep problems increase risk for certain dementia types. So if you're acting out your dreams, you should go get checked out because you may be at risk for Parkinson's disease or its cousins. Okay, traumatic brain injuries. This is why this is so important. So, let's say so there are two ways of looking at traumatic brain injuries. You can have one really bad one, or you can have multiple ones throughout your lifetime. If you have one really bad one, you kind of come down here, and then you have several ways of recovering. So one way, you recover all the way. Then you may recover half the way and then kind of go downhill after several years. And then another is the black line where you don't recover completely all the way, right? So one big severe traumatic brain injury, really bad. This is why we say avoid falls, particularly in the elderly. One way to avoid falls, if you have balance problems, is to use cane and walker. Another problem that most people over the age of 60 don't want. They don't want cane, they don't want walker. It makes you look old. Cane and walkers are prescriptions. Okay, they are drugs, just not drugs in that you take a pill, but they are a prescription that help you walk better, that's treating your balance problems. That's why it's so important. The other thing you can have is multiple concussions throughout your life. So this is the Will Smith movie, right? Chronic traumatic encephalopathy. So you start at normal, over here. You have one concussion. Maybe you recover all the way or not all the way. Then you have another one that's a smaller one. Then you have a bigger one, and so on and so forth. And sometimes, if you're really lucky, you may recover all the way and stay pretty good. Other times, you may start to decline after several years, even though you recovered all the way. And then sometimes, you may only recover halfway, but stay there, plateau. Or you may decline in this orange line. So you have many ways of going. The best thing to do is to avoid repeated injuries. It's also to avoid one big injury, but really just avoid injuries to your brain. So this is me talking about chronic traumatic encephalopathy. And really you can have many different symptoms. You can have memory loss, but that's not the only one. You can have confusion, you can have personality changes, you can feel depressed, anxious. So there are many, many ways. And you can have sometimes erratic behavior. That's another thing that trauma does to your brain. And finally, medication side effects. So it's not just what you're doing to your brain, it's also what we are doing to your brain. Prescribing you medications that affect your brain. Sometimes appropriately for a particular problem, but not so great for your brain over the long term. So over-the-counter medications that affect your brain include ZZ quills. Many people in my clinic have been taking ZZ quill for a very long time. That's terrible for your brain. I know it gets you to sleep, but it doesn't get you to the deeper parts of sleep, which is the quality sleep you need. And it's terrible for your brain. Benzodiazepines, that's your Xanax, that's your Ativan, that's all of these things are not good for your brain. Sometimes we do prescribe it for anxiety, but long-term use is not good for the brain. Why? it decreases the activity of the brain. That's why it doesn't do very well with paying attention over time. Now, obviously, if you're really anxious, we want to decrease the activity of your brain. That's why we prescribed it in the first place. However, revisit all your medications with your doctors once a year to ensure that you're not on any medications that is contributing to your cognitive problems. You don't want that. And so there are medications that affect particularly older adults, like anticholinergics, antihistamines. Those are your diphenhydramines that help you go to bed. All the Zyrtecs you're taking. So Arizona is really bad, right? Everybody is taking Zyrtec every day to survive here. Try your best to use non-pharmacological things. Try to use saline nasal sprays. Try to use the neti pots. Try to use a humidifier in your home. Try to do things that help you and if you're going to use Zyrtec or Reactin, use it sparingly. Use it when things are really bad. Try to work with your doctors as best as you can to find medications that don't affect your brain. And finally, mood problems. Depression and anxiety make everything worse all the time. Depression and anxiety is really, really common. You can have it early in your life, and that can get worse over time if not treated properly. Depression and anxiety makes memory loss and thinking problems feel worse, but also it can cause memory loss and thinking problems, so that we used to call it pseudo-dementia. Depression was called pseudo-dementia. So treat depression. There is nothing wrong with seeking help for depression and anxiety. I'm looking at the men in the room. So the reason for that is many people in my clinic, particularly men, will say, well, I don't feel depressed. You don't have to feel sad to be depressed. In men particularly, depression can manifest as irritability, frustration, anger sometimes. So those are other symptoms. So having stressful life events can trigger it, but you don't have to have stressful life events to trigger it. Depression and anxiety are neurochemical imbalances in our brain, and dementia already makes neurochemical imbalances in your brain, and now depression and anxiety will make it worse. So things we can treat, we should treat. Depression and anxiety are those. So, summary. Sorry, I said I would talk fast, but I didn't. And I kept talking. I can talk about brain health all day long, but really, minimize diabetes, treat high blood pressure, stop smoking, reduce air pollution as a society. Try to stay active. Obesity is really, really bad for you. Exercise as much. Try to treat your depression, treat hearing impairment, be active socially, get out there, talk to your neighbors, and get as much education as possible. Okay, so then, I just want to say that scientists are working on things. There are nutrients and things out there that will help your brain. They're just not at that stage where we can tell you to take this. But this is a small trial that was published last year. This is a cocktail of nutrients of various different lipids. And what this shows is that the blue is people who didn't were on the placebo, and the red is the people who did take the nutrient cocktail. And what we're seeing is that this is a measure of cognition, and people who did take the nutrient did better 36 months out. They didn't have as much decline, so higher scores is worse in terms of decline. And then the same with MRIs. Even their MRIs were a little bit better 36 months out. They didn't have as much change in their MRIs. So we are getting there. Things are being worked on in clinical trials. They're just not there. The reason I bring this up is I get this a lot in my clinic. Should I take what they advertise on TV? And I say, sure, you can, but you should ask yourself the same questions you ask me when I prescribe you a drug. So one of the things to know is that when something is a nutraceutical, so not something you need a prescription for, it's not regulated. It falls under the food component and not the drug component of FDA. So they're not regulated in the same manner as drugs are, right? You don't need to have the same level of evidence for approval, right? And so be careful. It's not to say that there are not natural things out there that help your brain. It just means that don't let somebody else use your vulnerability to their advantage to make money. So ask your doctor, have there been studies done on this? Google it. Are there studies? If the studies seem confusing, bring it to your doctor. Ask them to interpret it for you. What are the possible harmful effects of this? What are the ingredients in this thing that they're advertising? And what does it cost? Because it doesn't always, it's usually not covered, right, by your insurance. So what does it cost? And do the benefits outweigh the risk? This is the question I ask every day before I prescribe a medication. Do the benefits outweigh the risks? So maybe something is not beneficial, not harmful, but is very costly for you. Do the benefits outweigh the risks then? So think about that. And I specifically get asked about this. And so I will direct you to this article in, I want to say, Washington Post. I think it gives a balanced view. And I would say that go read that article. Okay, so what are some local resources? So, we try our best to kind of reach out to the community as much as we can. We talk about brain health check-in, and then Center of Healthy Aging. We do have our Center of Healthy Aging. And then finally, we do have sessions for preventing Alzheimer's disease. These are educational sessions that you could also stop by. And you can find us at our website and all the other places that Chan has told you